Psychiatrists are medical doctors who diagnose, treat, and help prevent mental health disorders. Their duties include prescribing, directing, and administering psychotherapeutic treatments and medications to treat mental, emotional, or behavioral disorders. Treatment may be delivered on an inpatient or outpatient basis, depending on the severity of the disorder. Typical disorders that they work with are anxiety disorders such as panic attacks and post-traumatic stress, bipolar disorders, eating disorders, schizophrenia, substance use disorders, attention deficit hyperactivity disorders, and dementia. Many psychiatric disorders can be caused by physical illness, and in turn, many patients with mental illness are at greater risk of physical illness. Psychiatrists, therefore, look out for symptoms of both body and mind. Many psychiatrists specialize in subfields. For example, working with children and adolescents up to 18 years who suffer from mental illnesses, working with the elderly specializing in psychiatric illnesses such as dementia, doing forensic psychiatry in prisons and secure hospitals, acting as expert witnesses in court trials, and addiction psychiatry, attending to people with substance abuse disorders. Specific tasks depend on the specialization field. However, the main responsibilities are common to all the specialization fields. They assess and evaluate patients by reviewing their mental and physical health. They check the patient's background, looking at issues such as their current social situation, past health issues, as well as any potential risk factors that may impact on treatment or behavior. After they have evaluated the patient, they decide on a suitable psychiatric treatment plan for the patient. This plan often includes a combination of psychological, medical, and social interventions. They work closely with other health professionals such as psychiatric nurses, social workers, psychologists, and occupational therapists in executing the treatment plan. If necessary, medication is prescribed for the condition of the patient. They take notes and keep detailed records of their assessments, interactions, and treatment plans. An important part of their work is to monitor and review treatment regularly to determine how effective it is. It is important to note that in order to become a medical specialist, the first step is to be selected for and graduate as a general practitioner. This means excelling at the subjects of mathematics, physical science, and life science at school and getting selected to pursue medical studies at university. After you have successfully completed your studies, internship, and community service, it still takes another few years of work and study before you can register as a psychiatrist. Psychiatry will suit you if you have a strong scientific mind, excellent verbal and non-verbal communication skills, and the desire to improve the lives of people with mental illness.